Today I want to tell you one interesting story. I happened to see this patient. She's 42-year-old lady. I did her surgery about 2 weeks ago and she came for suture removal. She had a fracture in her spine at L5 which had led to the slippage of the L5 over S1. It's called spondylolisthesis caused by spondylolisthesis, which means fracture. She was suffering severely. She had significant back pain, and because of nerve compression, she had significant leg pain also. And she was suffering for a long time. And she was suffering since last 3 to 6 months. We tried physiotherapy, medicine, etc., and it didn't work. And she is an office-going person, so she wanted to be active. She didn't want to restrict her life significantly. She got convinced. I did her surgery, which was a minimally invasive MIS-TLIF surgery, in which what we do that we remove the disc, we put a new spacer over there, we remove the pressure on the spinal cord and the spinal nerves so that the leg pain will go away, and then we put screw in the bone above and below to fix that fracture part. Everything went well. Patient went home 2 days after the surgery. She did great. She started walking on the same day after the surgery. At 2 weeks follow-up when she came, she had absolutely no symptoms. Her back pain as well as leg pain was gone. Now here the patient asked me, her wound had healed nicely. We didn't take any suture outside. It was all dissolvable stitches, so we didn't have to do the suture removal also. Patient suddenly asked me, "Doctor, I want to ask you one thing. Everything is going on well, but my relatives and friends are saying, was the surgery really necessary?" So this question of her had, I was taken aback by this question, and I asked myself why the patient asked this question. So I told her, yes, obviously you were requiring the surgery because there was a fracture. The bone had already slipped to grade 1 to 2 out of its place. You were suffering to the extent that your daily life was affected. You had significant back pain as well as leg pain, and you were developing numbness in the leg. So we have taken care of that. Your symptoms are all gone now. So why you have this confusion? So she was not. My relative was just saying that was this surgery necessary? Maybe we could have tried something else. Now in this case, because of the presence of the fracture, the surgery was absolutely necessary, and especially because the patient had significant symptoms. We would not operate on somebody with the same fracture and bone slippage or nerve compression if the patient did not have symptoms. But because the patient had significant symptoms, we did surgery on her, and luckily everything went well and patient recovered. So this question of her raised few thoughts in my mind. Number one, patients tend to forget their recovery. They only remember the remaining symptoms. So the way she was suffering, we would not take a decision for the surgery unless the patient is suffering significantly and enough to justify the surgery, and it's affecting her day-to-day life. Patient also will get convinced. Everybody wants to avoid surgery, and patient will get convinced for the surgery only when the symptoms are severe and they are incapacitated in their day-to-day life. So this patient symptoms to justify the surgery. Surgery is done. Patient is totally relieved of her symptom, but now this question, because she totally forgot what she was suffering from. Because now she is better, so all the problem which she had in the past, she forgot. Now this patient recovered almost to 100%. There are so many patients who recover to 80%, 90%, to 80%, 90%, and this remaining 10 to 20% keeps on troubling them. When I'll be getting rid of this remaining symptom. Now, when we do surgery, we cannot guarantee the patient 100% recovery, but we will not do surgery unless we are sure in our mind as a doctor that patient has sufficient pathology to justify the surgery, and by taking care of this pathology, we guarantee the patient at least 80 to 90% relief of the symptom. But for the patient that whatever relief has happened is of no value. At this stage, the only thing which bothers them is remaining symptoms. So that is one problem we face as a doctor from the patient, that whatever the remaining symptoms, that keeps on bothering the patient, and they totally forget the symptoms which have improved, the symptoms which are gone. The second thought which came to my mind, that there is so much of negativity around the spine surgery that even though patients, relatives and friends are seeing a successful surgery, patient is fine, she's doing everything, but they feel that maybe something could have gone wrong. Maybe she could have gotten paralyzed. Maybe she would have developed infection. Maybe she wouldn't have gotten better. So there is so much of negativity around the spine surgery that even if a live example was there in front of them, maybe they think that probably she got lucky and that's why she is better. Otherwise, there was a higher chance of the surgery not getting successful. The actual situation is totally opposite. Almost 95 to 99% of the surgeries in this era, they get successful. Now we don't claim that patient will get 100% relief of their symptom, but they will definitely be much better than what they are today before the surgery. And we take the decision for the surgery only when we feel that there is a need of surgery, either because of the patient's current symptom or because of the forthcoming problem the patient might face if they don't undergo the surgery. So these two things came to my mind, that patients tend to forget whatever relief they get, and there is so much of negativity around the spine surgery, and I think general population should get rid of this negativity which is which is spread around the spine surgery.